right, hello, losing Randy. So, it's cold out. It's really cold out. Like minus 24 wind chill, which to me is cold. But anyway, that has nothing to do with what today's Losing Randy is about. So today I had the pleasure of talking to Erin Elliott. Erin Elliott is a dentist friend of mine. She lives in Idaho, Post Falls, Idaho. And she's a general dentist, but she really concentrates on airway issues, sleep apnea, things like that. And on Twitter, a week or so ago, I posted that I'd be talking to her and asking for questions from people, and I got like 5 pages of them. So I tried to cover most everything that everybody asked. Airway issues in kids is what we were concentrating, since a lot of the people that follow on social media are young families, and it's amazing how big a problem this is that nobody really knows about. ADHD kids, if you think your kids have that, you really need to check into airway issues, tonsils, adenoids, things like that, because a lot of the symptoms are cross over with airway issues, and it may not be ADHD. Maybe these kids are getting medicated for something that they don't need. They need something else. So Erin, I don't know much about this stuff. I really haven't pursued that in my dental career, and certainly people say, "Oh, what's a dentist doing airway stuff?" Well, it's a mouth, and there's a lot of things in the mouth that affect the total health, and this is one of them. So she is by far and away one of the top people in airway issues in the dental field. So she has some great insights. And she's pretty funny too, so enjoy this episode of Losing Randy with Erin Elliott, DDS or DMD. I don't know what you are, Erin, one of those. So, Creighton, that'd probably be DDS. But she has a lot of answers, and we'll post some links below the video. Remember, down below. Write your comments, write your questions down below there. And if you like that type of stuff, let me know. I know a lot of people in the field of dentistry or even beyond, and maybe we'll do some on dental implants with my buddy Justin Moody. How about that, implant pathway? Maybe you can answer some consumer questions about implants. You're used to talking to dentists, but I bet a lot of people out here have questions about implants that you could help them with. So enjoy this episode. Erin's a fun person to talk to, and I got to meet her in Phoenix at Implant Pathway, and then at Voices of Dentistry, and yeah, she's a fun time. She's easy to listen to. So, all right, thanks for watching, and we'll see you guys next time. All right, so today we have with us Erin Elliott, and I am going to read off her bio for us here a little bit. Elliott. I just shortened it for you.
It's okay.
Erin is a California girl, played some college soccer, went to Creighton University for dental school, and you're out in Idaho somewhere. Post Falls, Idaho, correct?
Yep.
All right, so near as I can tell, see, we're right on I-90, just about 50 miles. So if I got on I-90 and just go west 1,290 miles, I'd be there, is how
What I say is that I am from Idaho, but just the tip. Idaho's really long and skinny, so we're way up.
Kind of like me. Yeah.
Yeah.
So, but anyway, Erin is a dentist, general dentist. Okay, you're not a specialist per se, but Erin is really big into airway issues and apnea and things like that. So what I thought, since we have a lot of a young following and young mothers, young families, that type of stuff, we're going to talk about some pediatric airway issues, because that kind of hit close for me, because I have a grandson who was he's just turned 6, and he was having airway issues. He went to his ENT over and over, and nothing ever happened, and they never really diagnosed anything. And he's very nasally speaking. A lot of the little signs that we're going to talk about. So I finally brought him in and did a 3D image of him, and it's like his sinuses are absolutely clogged. His tonsils are humongous. He doesn't have a tongue tie, and I just recently kind of read this list of comparing the signs of airway issues for pediatrics with ADHD type of symptoms, and we just went through and checked off every one of them.
Yep.
And I'll post this. I'll have him put this up on when he edits the YouTube. But it's just a bunch of signs that can be either one. There's a lot of cross things. So that was kind of the first thing I was going to address, is just what are a lot of the symptoms that are similar both to ADHD and could be airway issues, and how common is that to be?
Unfortunately, I feel like the medical world is not as in tune with airway as they should be. So many kids just get passed over. The problem with kids is they don't know how to tell you they don't feel good because they have nothing to compare it to. Most often the airway issues are from when they're a child. I think the biggest thing that you could look at is if your child snores or even heavy breathing or breathes through their mouth. Those are two huge signs that there could be something blocking the airway. And because in kids, their nervous system isn't well developed, the fatigue, the exhaustion actually shows up in more ADHD type symptoms. Just like, when a kid's really tired, they get wired. You can ask me how I know, because as you read in my bio, as you read in my bio, to go see my in-laws, I have to fly to New York. So when my kids were young, I gave them both Benadryl to get through the flight. Well, I had one kid asleep and then one kid running up and down the aisles. And so oftentimes this catch-all of ADHD really is sleep disordered breathing or a problem with their airway at night. So they're not getting the good deep sleep that they should be getting. Before you put your kid on any sort of medication, I think it's worth asking the question. The problem is pediatricians think people like me are crazy. And so finding someone that's more in tune.
Is that mutually exclusive?
Sore throats, right? They think I'm crazy anyways. Now, this on top of it.
So, and exactly, because, they took him into the ENT, and it was just, oh yeah, well, you got an active kid, you got a whatever. Never said anything about his tonsils, and I'm okay. We're gonna pretend like I know nothing about airway, because I know nothing about airway. I have not taken the Erin Elliott airway in course yet, but at 3D dental, or isn't that what it's called? Something like that.
3D dentist, yeah.
Yeah, I've not taken that yet, but it's on my list. So I will be concerned.
We just I just give a general overview for kids, but nasal congestion, like all the time, even grinding your teeth, bedwetting later in the years, that's called enuresis, and that's a sign of disordered breathing at night. Like I said, snoring and even heavy breathing. Even a kid should not pause in their breathing at all. Grinding of their teeth. I could get more into the dental signs and symptoms, but that's more for so there's a lot of learning, disabilities. The kids just aren't getting the deep sleep that they need, or even being on the smaller end of the growth scale. Human growth hormone is released in deep sleep. Kids that only will drink milk because they just can't swallow because their tonsils are so big, or even avoid more crunchy foods. So there's a lot of subtle things that, if you put the pieces of the puzzle together, you may just solve your kid's problem.
So what does happen? What happens at night when they're sleeping and they get this disorder? What is it that causes the change? Okay, there's lack of sleep, but what does a lack of sleep do? Is it an oxygen level that's deprived that kind of starves the brain and gets it kind of, or what's,
yeah. Well, if you think about it, oxygen is the number one drug our body needs, right? And we're going to get it no matter what. So as we go into the deep sleep, if the airway is obstructed by tonsils, adenoids, or even just a, smaller airway, the body's going to wake itself up with adrenaline or that fight or flight that, you know, we talk about, in order to start the breathing again. And so it's just this bad cycle of never getting into the deep restful sleep. Another sign is kids who seem, you know, a lot of times parents tell me, oh, my son sleeps just fine. His head hits the pillow, he wakes up in the morning. But what kind of quality sleep is he getting? Are the bed sheets messed up? Like, is there a lot of tossing and turning, even like heavy sweating? All of these things are essentially our body's supposed to be resting. Instead, it's fighting and working to get the oxygen it needs. Forward head posture. There's so many signs that, you know what, I have a 14 and 12-year-old son, and my 12-year-old kind of fits the bill for all of those things. Frequent ear infections, that he always had snot running out of his nose, and the mouth breathing. So
we see them snotty nose every day. I swear.
missed my chance, but I just didn't know, you know.
Yeah. Well, sometimes you don't know what you don't know.
Yeah.
So I'm gonna go through. Let's see. So this is just a couple of the obvious questions that people are asking. So tonsils and adenoids, that's kind of almost one of the first things that gets treated, right? Because and they don't take tonsils out as, you know, way back in the day, everyone got their tonsils out.
Yeah, it used to be 1 in 3. Now it's 1 in 8. But the problem is you really have to become an advocate for your child, because you need to find an ENT who understands why you're doing it. It's not about sore throats. And so ENTs really don't, they like to be conservative nowadays. And I feel like it's not giving the kid a chance at a younger age. Yes, they may outgrow it, but I could quote study after study that waited to be conservative, and then 70% of them still got their tonsils and adenoids out.
What's the minimum age for getting tonsils out?
You know what? I've seen young 2-year-olds, but you know, I can always tell when they got them out later in life because of the growth and development of their mouth. If they're breathing through their mouth all the time, mouth open, even chapped lips or lip licking, thumb sucking, all of those things go along with their natural way. That's how they get their tongue out of the airway. That's how they get oxygen.
So those little kids that come in and they lick their lips chronically and they got that. Oh, yeah, I've seen a few of those.
That's my own observation. I should not say there's a study on that, but
it's maybe something to mention to the parents.
Yes, taking the tongue out of the airway. So tonsil and adenoids is the first, you know, thing that people talk about getting, but there's a second component to that, and that's getting the orthodontic growth and development so they can relearn to breathe through their nose. It's pressure from the tongue that allows proper growth and development. And if they never get the muscles activated again to help them breathe through their nose or get their nose clear, they'll continue to be mouth breathers, which is a bad, it's a chronic issue. I mean, God made this for a reason.
Yep. And so clinically, what would you see in someone who has an airway issue? Would you see a high, narrow palate and a crossbite?
Our upper jaw essentially should be more broad and flat. And the way that happens is pressure from the tongue. The tongue should be resting on the roof of our mouth. And if the mouth's always open, then the palate doesn't grow properly. It's constricted. The lower jaw stays constricted, and then everything is constricted. So it just makes them become adult apneics, essentially.
I've seen
getting an orthodontist that gets it too.
Yeah. So Barron, he's talking about arch expanding and that type of stuff. So yeah, there's a lot going on in there. So what other? Teeth grinding.
Yep.
With these kids. I mean, every day, my kid grinds his teeth. What can I do? And I've always said, nothing you can do for the kids. Can't make them a night guard or anything, but that is also a common sign, huh?
Yes, it is. And I would say that some teeth grinding is, their adult teeth are moving in. It's kind of like that transition age. But for the most part, if I see any of these red flags, I just start asking questions to the parents. And teeth grinding essentially braces open the airway. It is another way that the body gets oxygen. And so it just begs the question, is something more going on? And I have to coach the parents. Like I said, don't talk to your pediatrician because they kind of just say I'm crazy. But I refer them to an ENT as well as an orthodontist that can help them. However, this is a great resource for some of your moms out there. They could do a dentist search on thehealthystart.org or .com, thehealthystart.com. And these are dentists, general dentists, that are kind of trained to look at airway and can become a quarterback for you. And
I wrote that down and showed my bald spot at the same time.
It gives you that secondary treatment of expanding the arch and regaining muscle tone the way that we should, in a very simple way that doesn't involve braces.
Yeah, I actually, we took the little guy, my grandson, to a pediatric pulmonologist. And, he just walked in the room and the guy says, "Well, you have it." And then he looked at his dad and said, "You have it."
Yeah.
You just
and you have sleep apnea. It's like Oprah.
And, so just visually he could see signs. And then of course when he did the exam, he saw the same stuff that I was kind of seeing. That little guy grinds his teeth awful. So okay, so
or even when they were babies, like did they spit up a lot or have acid reflux, tongue tie, problems latching? The list goes on and on.
So I posted on Twitter that I was going to talk to you, and I got pages and pages of
oh, wow.
So a lot of them are repetitive, and I'm just kind of, all right, so nasal speech, obviously, that can be a big part of it too, can't it?
Yep. Muffled voice, I talk about. Yep, that's definitely one of them.
I mean,
and the problem is, once you start breathing through your mouth, because the tonsils are so big, the tonsils continue to get bigger. I mean, bacteria is not filtered, and it can just hang out there and create more issues, especially when the kids are young, 6 and under. The bacteria settles right next to where the ear canal comes in. And that's how it's related to a chronic ear infection.
And how often do parents say, our little guy's got horrid breath,
Yeah.
There and that stuff. Let's see. So my kid had 20 cavities when he was 4. That's like 1 in every tooth. That probably doesn't have anything to do with it. Oh.
Well, dry mouth.
What's that?
Dry mouth.
Oh, yeah, dry mouth. Or if they grind through the enamel, too. Get that dent exposed. My kid grinds as an OB nurse. First thing I always check was that. Yeah, well, I'll just go back to my notes. All right. So how does a tongue tie and that type of thing affect airway? Because if they can't get their tongue out, it's pulled back and it can collapse in the airway, I assume. Is there some connection there?
Yeah, and there's some speech consequences. And if you think, our tongue actually helps clear food debris and that sort of thing. So it helps us keep our teeth cleaner too. But if it's trapped, that mostly the biggest consequence for that is when they are nursing.
Sure.
And nursing actually provides proper growth and development as well, as the infant is growing. And so if you go to a bottle, it's just not quite the same. Pacifiers, kind of the same thing. But a tongue tie release can help the baby nurse better and then allow proper growth and development. As a toddler, that sort of thing, it's usually speech and prevents the tongue from coming forward out of the airway. Instead, it's trapped back and can crowd it.
Okay, that makes sense. So let's see. So we covered across symptoms. So when like adults, when they do sleep tests, they always they're measuring the O2 levels, and it gets from
Yeah.
98, and some people get down into the 80s. What's the lowest you've ever seen in an adult that wasn't dead?
Oh gosh, in the 60s. Like it's crazy how underdiagnosed this is. That I think it's not an awareness, or there's just no perception that there's an issue. I just got a text today from a healthcare provider that said, I just snore, I don't have apnea. I'm like, how do you know that? He goes, well, my wife told me I don't. Like, we're going to get you a sleep test. Kids don't always need a sleep test. That's not necessarily where you have to start. Because if the tonsils and adenoids are an issue, the ENTs will just take them out. But again, the second part of that is finding an orthodontist or a dentist that can help catch up all the proper growth and development. In pediatrics, if the child stops breathing just one time an hour, if the child stops breathing just once, they have apnea. A child should not snore, and a child should not pause in their breathing at all. In adults, the scale is a little different.
So I'm going to go to adults just a little bit here. So everyone kind of has if they don't know a lot about apnea and airway issues, they think, the only people that have sleep apnea are, well, people like me, overweight, stocky, thick, but
Yeah.
I mean, you don't have to be a big, huge fat fella to have apnea.
No, I treat like the top athlete in our county had severe sleep apnea. And he was just able to overcome it because he couldn't stop breathing for a long time. But we were able to treat him. You cannot tell by looking at someone. The biggest sign in men is snoring. In women, it's insomnia. Oftentimes women wake up because of the apnea or their airway collapsing. And then they chalk it up to, oh, I'm so stressed out. And they think about all, it's underdiagnosed because there's a lack of awareness. We should not be waking up in the middle of the night, and we should not be snoring. And women snore too.
So some people are going to be thinking, what in the hell are we thinking about apnea for? We're dentists, fix your teeth, get the hell out. But I mean, airway goes through the mouth and the nose, obviously.
Yep.
And there are
airways all day long.
Yeah, there's dental applications, so you can treat apnea in an adult with a CPAP, which is the tried and true method. But there's also the dental appliances. Do they work as well as a CPAP? Or
yeah, there's all these parameters we look at, but essentially an oral appliance for sleep apnea is kind of like a night guard that fits the top and the bottom, and it postures the jaw forward. So if you've ever taken CPR, in order to get an airway, you bring the jaw down and forward. That's essentially what an appliance does. It mechanically opens the airway, where a CPAP just blows enough air to open up the airway. It does not give your body oxygen. It's like a reverse vacuum. It just keeps pumping air in until your tongue and airway are open, or tongue's out of the way. But oral appliances do work, and they do work as effectively as CPAP in mild to moderate cases. Remember, I said there was a scale.
Sure.
For those really severe people whose airway collapse is horrible and their oxygen plummets, a CPAP is best. But there are times that we make them both. And so the CPAP is much more tolerable. So we direct, like I said, we become a quarterback for a lot of people because they don't know where to start. They don't know who to talk to, or they've talked to several people in the medical world, and they told them just by looking at them, there's no way you have a problem. That Dr. Elliott's crazy. I'm telling you, it comes up quite a bit how crazy.
Yeah, I notice a trend here.
But I just see my patients through different lenses, right? It's just so eye-opening once you start this journey of how common it is. And it's reported that up to 80 to 90% remain undiagnosed. And it takes about 5 to 8 years for people to finally get treatment on average. And my whole goal is to fast forward that so people and kids get the treatment sooner.
So, but do kids get CPAPs or mouth guards or
They
appliances?
can get CPAP. That's usually in kids who are overweight. Um, uh, because of the growth and development, there are some issues with CPAP compliance. Of course, that's an issue in adults too. I think that if we can fix the root problem, oftentimes we can eliminate some of the treatment that's needed.
Because
And
you
you know
can't
that.
really use an appliance on a kid because then they lose a tooth and you got to make a new one.
Oh yeah, you can't make an appliance, no. But the orthodontist can get growth and expansion,
Sure.
so more room for the tongue. I should mention too, since I have an audience, that not just talking about airway issues, but Americans in general and kids especially have horrible sleep habits. And teenagers should be getting 9 hours of sleep.
Huh.
And the
At night,
preteens,
not during school.
yeah, at night. The elementary age should be getting even more than that. For every hour that they're deprived of sleep, they have a 300% greater increase of being overweight. Like it's a huge correlation and kids aren't getting enough sleep. And it's not the school start
I must
time.
not sleep at all.
It's the staying up too late. We need a good, healthy bedtime routine. Get them in bed early, get them settled, no screen time, no electronics. So there's a lot to be said for sleep hygiene is what we say. That doesn't mean clean sheets, although those help, but just good sleep habits.
Sure. Let's see. So how long we been doing this? Oh, 20 minutes or so. So I like to keep it under a half hour, so we'll probably get the end here pretty soon. So if a parent has a child who, whatever age,
Yeah.
a child, and they think, man, this kid, he's crazy. I can't deal with him. He has ADHD. So they take him to a doctor. They put him on whatever they put him on and everything.
Well, think about what that
odds are it
medication
might be
is.
something else, right?
Huh?
Odds are it might be something. I mean, all we hear is about
Yep.
how ADHD is so common now. Well,
it's airway.
Yeah. I think a lot of, and who knows what percentage of ADHD actually is misdiagnosed and is airway. Do you know what percentage?
Yeah.
Oh, well.
They say 20% of kids have issues, but it's like 0.5% actually get diagnosed.
Okay.
So there's a huge gap. But again, it's probably higher than that. It just gets misdiagnosed as allergies, the ear infections. And kids cannot tell you they're tired because they don't know what feeling is like.
That's their normal.
Yeah. Yeah, and it's so crazy. As soon as we get kids treated, they're like, they sleep peacefully. One kid said, man, like it's so much easier to make my bed in the morning because all he has to do is pull up the sheet instead of rearrange the entire bed. Or Mom, I'm dreaming again. I can remember things like these. This is from a 9-year-old.
Yeah.
But he didn't know any different, right?
Yep.
And ADHD medication is actually speed. It's not something to help them sleep. And so the correlation is huge to the point where some leading ENT airway surgeons in the country believe that ADHD is only airway, like it doesn't exist otherwise.
That's interesting. So if a parent wants to get it checked, first look in your kid's mouth. You see some ginormous tonsils, maybe that's where you go.
I think mouth breathing is an easy one too. So instead of like trying to force the kid's tongue down, some are more obvious than others. And just because the tonsils aren't big, it could mean that the adenoids are and completely blocking, but you can't see adenoids. And so mouth breathing is like a big indication.
Yeah, our little guy, I don't know if he ever breathed through his nose. When I looked at his cone beam, I mean, my God, there was no opening. It was just all, how it's gray on the.
So what would a parent do? I think, again, a pediatrician might be not as keyed in on this. Find an ENT that is willing to listen. to the story, but finding a dentist that understands too, that could help you get to the right people and into the right treatment. Again, that Healthy Start is a good resource.
Okay.
You have like a find a provider on there. I've gotten a couple people seeking me out that way, because there are some additional treatments we can do in addition to the tonsil and adenoids out.
Sure. All right. Let's see. So I'm going to, what should I put as a list for people if they want to check out? I mean, you have your office website, but what else? Is there something that I could post on there? Anything?
Oh, for them to find me?
Yeah.
I have a Twitter.
What's that? You have Twitter?
I have a Twitter.
Okay.
Yeah.
Tag you on it.
I need to get on there more. Erin Elliott, DDS, 2 L's, 2 T's.
Oh, I know. Okay.
And then Facebook and Instagram.
Are you one of those? Are you one of those Instagram gurus that post all your cases on Instagram? Some of those.
No, I don't post my cases.
Their margins and all that stuff, and
no, I have
grandkids.
But that's where the younger. That's where the younger people are. My kids and their friends are.
Yeah.
So that's definitely, you can just HMU. Hit me up.
Oh. I posted some dental stuff on my Instagram, like live surgeries when I was at Implant Pathway and stuff, and I lost like 3,000 followers, so I don't know. Apparently people don't follow me to see surgery.
Randy, I didn't know how big you were, like not size-wise, but I was telling my team that I was going to be doing this, and I was like, yeah, it's Chelsea's dad. They're like, Hauska? Like, my entire team knew who you were. It's kind of funny.
Creepy, but funny. So, all right. Well, I'm going to wrap it up then and give this to John. He's the guy, John Watts. He does all the editing stuff. He does movie stuff too. So,
hi, John.
Hi, John. And great. And if people come up with a bunch of more questions or something, maybe we'll do it again. How's that sound?
Yep. That sounds great. I would love to hear, or love to help and hear about some success stories.
Do you ever speak I know you teach the stuff. Do you speak to lay people, just, community stuff like that? Or
yeah, I sure do. Yeah.
Okay.
Anyone who will listen, I'm trying to spread the word.
So they know how crazy you are, right?
Yeah.
So, all right. Well, I'm going to hit stop recording here.
Free socks.